whenever you're ready.
Good morning. I appreciate you joining me this morning. We obviously have been working very hard over the past weeks with an aim to get our kids back to class as soon as is possible and as it is safe. In the meantime, we have frontline workers within our communities doing incredible work to keep us safe. Nurses and doctors, PSWs, those that are sacrificing to ensure that our communities are safe, that our hospitals continue to deliver good supports to families that need it most. But we recognize as this elementary school closure is extended, that more people, more emergency and frontline workers will need support in this province. And that's why today we're announcing an extension of the emergency and free childcare we're providing to our frontline workers. The first phase of it existed for this week, but obviously given the extension to the 25th, we think it is reasonable to extend that free service for another 2 weeks and to expand it to include more frontline workers within our economy and within our society. People like those in the Canadian Border Service Agency working to ensure the integrity of our borders, critical at this time as we deal with the pandemic. Women and men who work in our emergency shelters, our children's aid societies, people who are doing incredible work to the most vulnerable in our communities, and likewise, those workers that have to go into those isolation motels and hotels, helping to support those vulnerable and low-income families so that they can isolate safely and that we can help reduce the risk within those communities. And so today we're expanding that capacity. We have utilization to date of roughly 2,200 individuals have taken up our offer of free childcare. We have capacity of roughly 28,000. Expanding this will allow us to responsibly build up and enable more workers to receive free childcare during this difficult time while these individuals have to physically go into class, or rather physically go into work. And that's the basis of our expansion today. In addition, I want to remind parents that on Monday, January 11th, all children between the ages of 12 and up to grade 12 can apply for the Support for Learners program. That's ontario.ca/support for learners, where you're eligible for $200 for every child between that age bracket. You can sign up online. It takes roughly 2 weeks from verification to receive monies directly into your pockets. And obviously, we continue to work with the Chief Medical Officer of Health over the coming period of time to ensure that kids can return to school when it is safe, building up our protocol with additional investments and layers of prevention to enable that return. We all want that. I think we're all firmly committed to doing that. We just want to make sure it is first safe. Thank you.
First question comes from Mike Crawley, CBC, and also the Chief Financial Officer for the Media Gallery. The Premier said that he saw the modeling numbers and you'd fall off your chair if you saw them. Right. He also said that 1 in 5 school kids is testing positive.
Right.
Have you seen the modeling numbers for the school children and people that go with the education? Have you seen it, and what is your reaction to those modeling numbers?
Yes, the modeling numbers will be coming out on Monday, led by our doctors at the command table. I have seen those data points, and they are alarming. Roughly 117% spike in cases for young people between the 27th of December and January 3rd, once schools were closed, once they were home effectively and outside of our schools. There was a massive spike in case numbers, and that's alarming. It's concerning, obviously, for any objective mind that sees that. That data will be released to families. I think what it underscores is what the Premier said yesterday and what Dr. Yaffe said yesterday, which is the trend is problematic, and we have to take this seriously. We have continued to see high numbers of cases in this province, over 4,000 yesterday, 4,200 yesterday. And obviously with a great sense of sadness, the highest level of fatalities. We, I think, are at an important inflection point, and we need to act. And that's why that modeling, I think, will be very helpful for Ontarians to see the problem and to understand the difficulty we face.
This is Malaya from CTV. Parents have a huge amount of anxiety looking at how they're going to deal with daycare and taking care of children that
Right.
are working, if they are working. Can the parents plan long-term and decide, because the online numbers are so big, and show such an increase that school won't be going back until the summer?
Yeah.
Or late spring?
You know, I think certainty is something everyone wants, and we understand that. I mean, I think every parent in Ontario just wants to know what's going to happen, and obviously we want to provide that predictability. The decisions we make are based on data. Sometimes it comes to us, the day before we go out to make an announcement. It is information that I think when you review it, and any responsible government that looks at it would have to make the difficult, albeit the necessary decision to keep kids home in order to protect the progress we've made in our schools, and really just to protect your families from potential spread from our kids. And so my commitment is to work with the Chief Medical Officer of Health, as we have done and we will continue to do, to provide as much clarity as we can, recognizing this is not easy on you, on working parents that also, in some respects have to, take on the role of teacher and caregiver and worker. And I don't imagine for a moment this has been easy on you at all, for the last year, to be quite frank. How we can support you is providing information in real time and really being upfront with you. And so for the next 2 weeks, students will be home. Our aim is over the period of time to build up our plan that can help get kids back. Part of it is going to be based on the broader reality, the broader community spread, and the broader trajectory of this deadly disease. With that said, in the Ministry of Education, working with the Premier and the Minister of Health and Dr. Williams and Dr. Yaffe, we're building up our plan with the hope that we can get these kids back. Whenever we can get them back, we want to make sure that the plan is stronger. That's why we're expanding asymptomatic testing province-wide, which we think that surveillance program, very targeted program, will really help reduce the risk and also help us identify if there is asymptomatic spread. Let's identify the cases, let's isolate those cases and get the kids home and the care that they may need. And protect the integrity of our schools, the safety of our schools. We're also going to be announcing additional investments, $380 million more to improve air ventilation, to hire more staff, to hire more custodial cleaners and more PPE, all of which is going to help us counter this threat. And I think, we are accepting the advice of sick kids to use this period of closure to really build up our protocols and really identify those schools and those areas of challenge and vulnerability to make sure that we invest as much as possible and do everything we can to reduce risk there.
What century measures, this is also what century measures are you going to take for daycares and schools when they do go back, or the daycares that are open now?
Yeah.
Testing, rapid testing, mandatory,
Yes, I think obviously access to testing will be critical. Part of our plan, of course, is the expansion of asymptomatic testing. That can include rapid testing and testing, saliva-based testing, which we have used in part at schools really in the fall. We're doing that with some success in high-risk regions of Toronto, Peel, Ottawa, and York, and the intention is to expand it. In childcare, I'll just also note that we moved from a passive screening where parents would really review the symptoms of children to more of an active screening where upon entrance, our ECEs, our childcare workers would be there to review and to ask those questions, and just to make sure the screening is at the highest levels, to make sure that we're not bringing in a young child that could have any symptoms and therefore could pose a risk to a child. So we've enhanced the protocols within childcare to make sure that they are safe, both for the staff, but obviously for these kids.
And this comes from Michelle from Canadian Press. Custodians, maintenance staff, and clerical workers, will they be included in this expansion? And the second part of that question is, what age range will the children that be eligible to receive childcare?
Well, with respect to the expansion, it's important we address this. So for any worker that has to go into a school within the education system as a consequence of keeping some schools open for special education needs, those workers, all of them, will be eligible for this emergency childcare, this free childcare. So if an educator or a custodian is being asked to go into a school physically, they can't work from home under this scenario, they will have access to that emergency childcare, and we think that is important. At the end of the day, we just want to make sure that those that can't work from home, to the extent humanly possible, they get the supports I think they deserve. And that's why we'll expand it to have access to another roughly 20,000 child spaces that could be benefited, will be benefited from this expansion.
Where are teachers and these custodians and all the workers in the queue to get vaccine? Where are they? And is it a thought to bring them up, raise them up,
Yeah.
a little higher to get schools open?
Yeah, I know the vaccination I think is a critical, really a critical pivot for our province through this great darkness and the difficulty of the pandemic. That is the light at the end of the tunnel. The fact that 100,000 people today have been vaccinated, really prioritizing long-term care residents and obviously frontline workers, I think is a really positive thing. We are now almost out of vaccine in this province. UHN reported yesterday from Dr. Kevin Smith that they essentially will have no more vaccine as of yesterday, and they have thousands of frontline workers on a wait list. And so obviously we're working with and encouraging the federal government as soon as possible to get us those vaccinations. I mean, before we can discuss prioritization, I think we have to have access to the vaccine itself. And right now we have a bit of a deficit of supply. We need more from the feds, and I think they know that, and we're working to get that. In the context of prioritization, I've spoken to the General Hillier, who's leading this process, and a variety of my colleagues, obviously with the aim to provide that assurance and that information to the education sector and to really all sectors that want to know where they fall in that. I think it's going to be important that we continue to vaccinate the most vulnerable. Right now, the aim, what we've committed to publicly, is really long-term care, some of the oldest citizens, and our frontline staff. And that's the priority for now, and we'll be able to have more information. We'll be able to communicate the next phase of this in short order.
And that an overwhelming big question is, when can people plan to have their children go back to school? The numbers are out of control. It doesn't look like it's early. And they have to plan long-term. They can't go in short bursts of it
Right.
to figure out. So are you going to be able to give a long-term plan when schools are open and or closed?
Yeah, look, I think we want to be able to provide as much certainty as possible to families. It's not easy to plan week to week or every other week, and we don't pretend it is. Obviously, in the context of our decision on Thursday, just to parents out there, and I know some will be frustrated, we received information Wednesday, critical data that I think moved a lot of us that wanted to get our kids back. But obviously, when you see information and you see a dramatic spike in COVID cases amongst kids over the holidays, I just think we had to act. We will not. The Premier has been absolutely clear. We will not, and we should not compromise the safety of kids. And so we provided that information less than 24 hours after it was received to parents, and we'll continue to be as upfront as we can to give you the planning certainty you need. COVID obviously throws a lot of curveballs. It's not. There's no absolutes, and I want to just be upfront with you. So as soon as we know information, we'll get it to you to provide you as much time as humanly possible. We want to get our kids back. There's just no doubt about that. Everyone is committed to that in this government, but it has to be safe. And so over the coming weeks, we're not just going to hope for the best, as I've noted, and as Dr. Williams has noted. We're working hard every day through this week and every day thereafter to build up a plan that has expansion of testing, asymptomatic targeted surveillance testing within all schools and eligible for all schools and public health units, expanding investments in HVAC. I mean, right now, 95% of schools in this province have reported through school boards improvements to their classrooms. We have 20,000 more HEPA filters, over 20,000 portable HEPA units. Those are those standalone air filtration systems put into smaller classrooms or into portables. We have 3,000 more teachers. We have over 1,300 more custodians, 600 more public health nurses invested as a result of our government's investment, and working with our school boards and obviously all levels of government to maximize safety and reduce risk. And that's our commitment. We'll continue on until we get these kids back.
Last question.
The modeling number, you've seen the modeling numbers. There's going to be a release there. What does it show for the schools, for the modeling numbers? You said you're going to bring information as fast as possible to the public. What do the modeling numbers look like for the schools, school-age children?
Yeah, I think what we can confirm is that over the holidays for the elementary group of kids, we've seen a significant spike in COVID cases. And that is very problematic. We pointed to one fact that I think is most problematic, about 117% increase. That is troubling. There's no doubt about that. And I think we all, I think upon reviewing that, I think we're rather shocked at how significant that increase was over a short period of time. And the plan to extend the closure for the first week and now for the next 2 is really because we want to see that come down. We want to make sure we're not reintegrating thousands of kids potentially with COVID acquired over the holidays that could infect your kids, their friends, and our staff. And so that was the rationale for why we acted, as difficult as the decision was, necessary to keep your family safe as we see rising transmission within our community. And the fact that our schools have been safe in this province, 8 in 10 schools in December when they closed for the holidays, did not have an active case at all. And many institutions have noted, and medical leaders, the Chief Medical Officer of Health, have said, look, there's been some success. We've done well in this province keeping kids in school against incredible odds, and we want to continue up that momentum. We just want to make sure when we get kids back, it is safe to do so, and they can stay in school for the remainder of the year. Okay, thank you very much.